Segment is paid for by Holston Medical Group.
When our children become sick, we want desperately to help them feel better. Oftentimes, we look to antibiotics to fight off the infection. Important medicines when used correctly. In tonight's Health Matters by Holston Medical Group, we learn the facts about antibiotics and why they should only be used when needed.
We see a lot of upper respiratory viruses, things like flu, RSV, common colds, of course COVID still. We see viral gastroenteritis, just a wide variety.
With so many things going around, it can be hard for parents to determine what it is and how to treat it. Is it a virus that needs to run its course, or a bacteria that needs an antibiotic to target and treat?
Certain symptoms can be more likely to be viral versus bacterial. Fevers can be seen in both. Sometimes you can have high fevers with both of those. With bacterial infections, you may have other symptoms, things that may point to like strep or pneumonias, ear infections, things like that, along with that fever. Viral illnesses, you can also have fever, but a lot of times you'll have cough, congestion, vomiting, diarrhea, those kind of things along with the fever.
Dr. Redder says it's important to remember antibiotics do not work for viral infections, and using them when they are not necessary can cause multiple issues.
You can have side effects, you can have antibiotic resistance if you continue to use antibiotics when they're not needed, which can cause problems down the road.
Dr. Redder also says there are several ways to treat a viral infection that can help your child feel better.
There are a lot of symptomatic management things that you can do at home using fever reducers like Motrin and Tylenol. You can use age-appropriate cough medicines. You can push fluids, especially things like fluid rehydration, like Infolite, Pedialyte, things like that.
Also, it is important to keep in mind what begins as a virus can transition into a bacterial infection.
When you have a virus, obviously your body is trying to fight off that virus. Your immune system can kind of take a hit, and then the bacteria use that situation to their advantage and cause secondary infections. If your child has a cough, congestion, maybe had a fever for a few days and then seems to be getting better and then all of a sudden acutely starts worsening, that can be a sign of a secondary infection, especially if the fever went away and a new fever has showed up. Or if the fever is persisting. If a child has a fever greater than 5 days, that's certainly something that we would want to investigate.
Dr. Redder also says prevention is still key. She urges vaccinations for flu and COVID and continued good hygiene like hand washing, covering your cough, and staying home when you're not well. For more information, please visit the Health Matters blog at holstonmedicalgroup.com.